We've got several topics to get to on this episode, so let's just dive right in. Can you give some advice to parents with kids who are struggling with bedwetting?
Yes, this is like such a common topic for general pediatrics. We dealt with this with our youngest. I would say stay calm, be patient. Usually your kid's going to figure it out. The number one recommended intervention for kids with bedwetting are bedwetting alarms. So basically, it's like a mat that's attached to an alarm that they wear, and when it senses moisture, it alarms this thing and it wakes them up. And so eventually it trains them to wake up when they need to use the restroom. And we use that for Chase for, I don't know, maybe like a month. And it worked. And then, there may be some setbacks. So try to stay patient. Be patient with your kids. Let them kind of figure it out and it'll get better.
Also, make it to where it doesn't feel like they're in trouble. I think that's like the number one thing that parents can do incorrectly is make the child feel bad about it. If that happens, then it's a whole set of problems that can arise. So just stay calm and reassure the kid.
Oh, and another good thing is making them part of the cleanup process. So if they do wet the bed, having them participate in like changing the sheets and putting clean sheets. So if they are participating in the cleanup process, then they're less likely to have future issues. So that can sometimes help as well.
Now, switching topics, can you talk about abdominal migraines in teens?
So migraines in general can start as young as 2 years old. As you enter teen years, it's a little different with hormones. Migraines start to pop up and you start to think about it. So usually abdominal migraines, they cause stomach pain, nausea, occasional vomiting, and it can turn into what we call like a cyclic vomiting syndrome where you just throw up a lot. And there's usually a family history of headaches and migraines. So if you have a family member that has headaches and then the kid starts having these episodes, one of the ways that you can treat it is acknowledge triggers. Are there certain foods, like meats, certain drinks, not drinking enough water, not getting enough sleep? Are there triggers that cause these?
It is something interesting, I think, to talk about because people may be experiencing these type of symptoms and they wouldn't necessarily think that it could be something neurologic. They always think, GI or something with the gut. So definitely, to keep on your radar, and hopefully your child never has these issues. But it's always good to know and be aware that this is something that potentially is a cause.
Yeah, and you don't always have to go straight to a neurologist. You can talk to your primary care provider first. And 9 times out of 10, usually they'll know how to treat that and find those triggers for you. And then if it doesn't work from there, then seeing us would be the next step.
Thanks, that's really helpful information. How about absence seizures?
They usually start occurring around 3 to 5 years old, and it's typically a staring spell. You can be in the middle of eating a bowl of cereal, stop, and then right back. It's usually with immediate recovery without any confusion right after. Probably up until 6, 7 years old, they start noticing in school, maybe grades start slipping a little bit, or they're in sports now. And the coach starts noticing the kid kind of staring off. Those are all kind of red flags to get it kind of looked at. They do an EEG, and the EEG is very important because it has a very distinguished pattern on that EEG, and that's called 3 hertz spike and slow wave. 3 hertz spike and slow wave is absence seizures. And then usually it does take medicine. I know every time I talk about medicine, there's a lot of questions on why are you talking about medicine first? That's a valid question, but with absence seizures, ethosuximide, the medication knocks them out almost all the time. Usually around teenage years, 14, 15, 16, absence seizures usually go away. I tell my patients to take it 1 year at a time. Let's be seizure-free for 1 year, and then we'll rediscuss whether the medication is needed. It's not an ominous diagnosis. It's something that just needs to be noted and treated.
So knowing that, why can these kind of seizures go unnoticed?
They can be misdiagnosed as daydreaming, right? So a lot of parents and teachers or anyone really that observe these type of episodes can just think the kids are daydreaming, they're kind of staring off and not paying attention. And so that's why it's super important to get the EEG, because that's really the only way to know for sure whether or not it's just inattention or daydreaming, or if it truly is absent seizures. And so in ADHD specifically, this is something to think about, because it could be the underlying cause for why it seems that your child is not paying attention, or they're daydreaming, not listening. And so this is one thing just to keep in the back of your mind, something to roll out for sure.
Especially if you failed multiple ADHD medications. If you felt like 5 medications and it's not getting better, you got to start looking at other etiologies.
Okay, so then what are the differences between absence seizures and partial seizures?
We talked about partial seizures in the past, and we're talking about absent seizures. They can both look the same. So the only difference is in a partial seizure, the seizure is starting from one area of the brain. In absence epilepsy or seizures, it's generalized and coming from the whole brain. So they look the same, but they're started differently in the brain.
Let's talk about ADHD, but from a different angle. What are some things not to do with a child who has ADHD?
Definitely don't blame yourself. As a parent, I think we tend to think, what did I do wrong? You can never blame yourself. Obviously, that's not going to change anything or be productive. So I think being as supportive as you can of your children and trying to figure out the best ways to manage it with the help of your, doctors. And then, of course, I think just staying patient with your children. I said one time to be as organized and have as much structure as possible. So you definitely don't want to do the opposite of just creating a lot of chaos and stress and being very disorganized, because that's going to be a lot harder for your child with ADHD to deal with.
And then I have a really good one. So don't blame the teacher. Don't blame yourself. Don't blame the kid. We got to start creating one team. I see very often that the school, the family, and the kids are on 3 different teams, and that almost never works. So do not create separate teams. Unify the team into one and come up with a plan.
Don't assume that it'll just get better on its own, which it may. As they get older, some children do become more mature and they can kind of better handle their symptoms on their own. But I think it's important to really understand what are the challenges that your child is dealing with, and then how can I best help them?
Yeah, and one aspect that I was thinking of what not to do is don't punish your kid for not paying attention. I think bringing to their attention that they're not staying focused or not listening to you or not looking at your face when you're talking to them, those are things you can guide them to understand and restructure the way they think. So I think not punishing them and then using that structure to provide an education to train them how to pay attention.
Cristina, this question's for you. Shaun's been really open about his ADHD, so just talk to us a little bit about y'all's relationship and the element that brings.
Yeah, be careful. Yeah.
That's a good one.
You can just let it all out.
That's a good
fine.
one. So initially when we met, I think he was newly diagnosed. So this was
Man,
medical
you're taking
school.
it back far.
We're
Dang. That's okay. All right.
Maybe it's relevant.
I'm ready. I'm ready.
And so he was newly diagnosed, and I think just trying to understand how to deal with it on his own. So a lot of times he's just very distractible and thinking about other things when he is talking, or if I'm trying to talk to him.
Thinking about think.
He's thinking about think a lot. Yeah. He does think. You do think about think a lot. So I think having him put down whatever he's doing has been key. Like, hey, put down your phone. Let's talk about this for 5 minutes. Okay, let's figure out, whatever it is. Like this, we need to, figure out this or what the plan is for the week. But I think of taking away distractions, like especially the phone, because a lot of times we're responding to you guys on Instagram. And so he's checking comments and things. But put down the phone, look at me, let's talk for 5 minutes. I think that has been very helpful. Being patient is key, right? Like he's like, I lost this. I can't find this. Where's this? I'm like, it's okay.
Lost my book this morning.
I always usually find it at some point for him, or he'll find it and he'd be like, oh, I put it here. So I think that you just have to be patient and understand that, we'll figure it out.
And I'll chime in here. I think one thing I told her a couple of years ago was just be direct. Mm-hmm. Just tell me what to do And my promise to you is I will not get upset. I will not give pushback. So till this day, I've really lived up to that. I may not want to hear it, but it's just best to hear it up front.
I've really been embracing that recently. I'm
Absolutely.
okay, tonight you're going to put Blake to sleep.
Yeah.
And so if I'm very direct, and you told me I won't say no. So.
Yeah, and it's important because not only do we live together, we work together. So I think having that understanding of how to communicate to help me stay focused is very important.
You guys can do it out there too. It's just staying patient.
If we can do it, you can do it. No, for real.
Yeah.
That's the truth.
Christina, we get this question a lot on Instagram. Can a child overcome ADHD?
Yes. So I would say yes. Personally, I've treated a lot of patients with ADHD that have been very successful, later in life. So I think it's just about first understanding what it is, understanding if your child actually does have a diagnosis of ADHD, and then what's the best way to manage it. And there's not one, I think, right or wrong answer. I think it's different for every patient, but there are certain lifestyle things that you can do. Being organized is so important, and not just in school, but what you're doing at home is super important, like having a routine that kids know. When kids know what to expect, it's easier for them to remember and follow through with that on a daily basis. Just being as organized as you can for your children, I think, really helps them to be successful.
I never had medication as a child or high school or college until I got to medical school. So I think understanding there's a couple of things you can do yourself to make it treatable on your own. One is structure. Provide structure for the family, for yourself. Find ways to learn that benefit you the most. I need a highlight. Sometimes my whole book is highlighted, and then I have to go back and highlight a different color of what's important. But that means I just read it twice. So you need repetition if you have ADHD. You got to do things multiple times. You can't procrastinate the day before a test and do well. You have to study for a week, one time a day, and you'll most likely ace that test. And then also anxiety. Anxiety and ADHD go hand in hand a lot of times. And when a child is not doing well in school, that's anxiety provoking. So helping kids understand it's okay to not be perfect. It's okay to fail every now and then if you can learn what to do the right way on your own terms, and then at your own pace. So address the anxiety, build structure, and find ways to learn. I think those are 3 really good ways to set them up for success.
Thank you both for today's information. Very helpful. We'll see you next time on the Think Podcast.